What if I told you that one of the most powerful tools for managing your blood sugar isn't sitting inside a prescription bottle, but instead lies in something as simple, ordinary, and often overlooked as when and how you drink water? I know that sounds almost too easy to be true. You might be thinking, I've been drinking water my whole life. How could that possibly make a difference with my diabetes? Or maybe you're skeptical because you've already tried so many things that promised results and failed to deliver. Supplements that did nothing, diets that were impossible to maintain, advice that sounded convincing but never showed up in your actual blood sugar numbers. I want you to stay with me, because what I'm about to share has made a real, measurable difference for hundreds of my patients. These are not theoretical examples or textbook cases. These are real people who were doing everything right and still struggling. My name is Dr. John Romeo, and today I'm going to show you exactly how proper hydration timing can improve insulin sensitivity by as much as 40%. I'm talking about people in their 60s and 70s who take their medications faithfully and never miss a dose, who follow their meal plans carefully, measure portions precisely, check their blood sugar multiple times a day, walk every morning, and still see unpredictable numbers. They still feel exhausted. They still worry every single time their A1C results come back. The frustration I see in my practice is very real and deeply heartbreaking. These are individuals who have been fighting this battle for years, sometimes for decades. They've spent money on special diabetic foods. They've given up foods they truly love. They've done everything their doctors have asked of them, and they're tired. Tired of constant vigilance. Tired of feeling like they're failing, even when they're trying harder than anyone else around them. Over the years, I've learned something important. Sometimes the most powerful medical interventions aren't the most complicated or expensive ones. Sometimes it's the basics we've completely overlooked that create the biggest and most consistent improvements. Recent studies from major medical research institutions have demonstrated something remarkable. Drinking water at specific times throughout the day can improve insulin sensitivity by up to 40%. That means your body becomes significantly better at using the insulin it already has, whether that insulin is produced naturally by your pancreas or supplied through medication. The key is not just how much water you drink. It's when you drink it, how you drink it, and what you add to it. Small, strategic changes in timing can lead to substantial improvements in blood sugar control. Before we go any further, I want to know where in the world you're watching from right now. Drop your city or country in the comments. I love seeing how far this message travels, and it reminds all of us that managing blood sugar is a universal challenge we're facing together. And let me be very clear about something. This is not about replacing your medication or ignoring your doctor's advice. This is about giving your body the foundational support it needs to work more efficiently, so your medications can actually do what they're designed to do. To understand why this works, you need to understand what's happening inside your body as you age. After the age of 60, several important physiological changes occur that make blood sugar control genuinely more difficult, even if you're doing everything right. First, your cells gradually become more resistant to insulin. They don't respond as quickly or as efficiently when insulin tries to move glucose out of your bloodstream and into your cells for energy. Second, your pancreas becomes less efficient at producing insulin, meaning you're working with lower levels of this critical hormone. Third, your kidneys don't filter glucose as effectively as they once did, so excess sugar lingers in your bloodstream longer instead of being cleared out. And here's the part most people, including many healthcare providers, completely miss. Your brain's thirst mechanism becomes far less sensitive with age. This is absolutely critical. You can be significantly dehydrated, even dangerously dehydrated, without feeling thirsty at all. Your mouth may not feel dry. You may not feel obvious discomfort. But at the cellular level, things are already going wrong. Even mild dehydration, just 2% below optimal hydration, which is barely noticeable to you, can raise your blood sugar by 10 to 15 points. That alone is enough to take you from good control to poor control. It's enough to explain those frustrating morning spikes or unexplained afternoon highs that seem to come out of nowhere. Let me tell you about a patient named Gerald. He was 68 years old, and I could see the frustration written all over his face before he even sat down in my office. Dr. June Romeo, he said, his voice tight with emotion. "I don't understand what I'm doing wrong. I eat carefully. I measure everything. I take my metformin exactly as prescribed. I walk 3 miles every morning. I've completely cut out sugar and white bread. I've done everything you and my other doctors have told me to do." He pulled out a small notebook filled with blood sugar readings. "Look at this. Some mornings it's 145, other mornings it's 185. Yesterday it was 162. This morning it was 178. Same breakfast every day, same steel-cut oatmeal, same measured portion, but the numbers are all over the place." His wife quietly added, "He tries so hard, but his A1C keeps creeping up. It went from 7.1 to 7.9 over the past year." We carefully reviewed his entire routine. His diet was excellent. His medication timing was perfect. His exercise was consistent. On paper, everything looked exactly right. Then I asked what seemed like a trivial question. "Gerald, walk me through your morning routine from the moment you wake up until breakfast." He explained that he woke up around 6:30, checked his blood sugar immediately, made coffee, drank his coffee while reading the news, and then around 7:30 made his oatmeal and took his medication with a glass of water. I asked him when he drank plain water. He paused, genuinely confused. "When I'm thirsty, I guess. Sometimes with my pills." That was the issue. Gerald went from 6:30 in the morning until well after 7:30 without drinking any real water. 8 hours of sleep without fluids, followed by another hour awake without hydration. Nearly 9 hours of progressive dehydration. We made simple, strategic changes. Every morning before his coffee, he drank warm water with a small pinch of sea salt and fresh lemon juice. 15 minutes before lunch and dinner, he drank a glass of room temperature water. He carried a reusable bottle and sipped consistently throughout the day. 2 weeks later, he called my office. His voice sounded lighter, almost excited. His morning readings had been between 125 and 138 every single day for a week. A month later, his average fasting glucose had dropped by 22 points, with no medication changes at all, just water, timed correctly and consumed strategically. Before I teach you the specific method that has helped so many of my patients achieve these kinds of results, let me explain the 3 most common hydration mistakes I see every single day. You are almost certainly making at least one of them. The first mistake is waiting until you feel thirsty to drink. Thirst is not an early warning system. It's an alarm bell that goes off only after you're already dehydrated. By the time your mouth feels dry, your blood has already thickened, your glucose levels have already risen, and your insulin is already struggling to work efficiently. Think of your blood like a river carrying glucose to your cells. When the river is full and flowing, glucose moves smoothly to where it needs to go. When the river runs low, it becomes thick and sluggish, and glucose gets stuck in your bloodstream instead of reaching your cells. The second mistake is drinking large amounts of water all at once. Many people go hours without drinking anything, then try to catch up by drinking a large glass. But your body can only absorb about 1 cup of water every 15 minutes. Anything more than that simply passes through without hydrating your cells. It's like dumping a bucket of water onto a plant. Most of it runs off, and the roots stay dry. Slow, steady watering is what actually works. The third mistake is drinking ice-cold water, especially first thing in the morning or right before meals. Cold water causes blood vessels to constrict, making it harder for insulin to reach the cells that need it. Room temperature or slightly warm water keeps blood vessels relaxed and open, allowing insulin to circulate more efficiently. This is especially important in the morning and around meals when your body is processing glucose most actively. Now let me teach you the specific approach I use with my patients, which I call the H3 method. The first 3 refers to 3 key timing points throughout your day, and the second 3 refers to 3 essential elements that make the method effective. The first timing point is first thing in the morning. This is the most important moment of the entire day. The moment you wake up, before coffee, before breakfast, before anything else, drink 1 full glass of warm water, about 12 ounces. Add a tiny pinch of natural sea salt and the juice of half a fresh lemon. After a full night of sleep, your body isn't just dehydrated, it's low on electrolytes. That small amount of sea salt helps your cells absorb the water properly, and the lemon supports a more stable blood sugar response. This simple morning ritual calms your stress response, lowers unnecessary cortisol release, and helps prevent that frustrating morning blood sugar spike. I've seen this single change make a dramatic difference for people who have struggled for years. And once you understand what's happening inside your body, it starts to make complete sense why something so simple can have such a powerful effect on blood sugar control. When cortisol stays elevated in the morning, your liver releases extra stored glucose into your bloodstream even if you haven't eaten yet. By hydrating properly with water, minerals, and a mild acidic component from lemon, you help signal safety to your nervous system. Your adrenal glands calm down, cortisol release is reduced, and your liver doesn't dump unnecessary glucose into your blood. This alone can mean the difference between starting your day at 170 versus 130. Let me share another real example. Elizabeth was 72 years old and had been living with type 2 diabetes for 14 years. Her biggest frustration was her fasting blood sugar. Nearly every morning she woke up between 165 and 175, even though her dinners were carefully measured and her bedtime readings were reasonable. We didn't change her medications. We didn't change her dinner. We didn't change her activity. We added just one thing: warm water with a small pinch of sea salt and fresh lemon juice first thing every morning, at least 20 minutes before coffee. 3 weeks later, her average morning reading dropped to 128. Same routine, same pills, same life. The only difference was how she hydrated when she woke up. She told me she also felt clearer mentally, less foggy, and more confident starting her day. That lower morning number gave her momentum instead of dread. The second timing point in the H3 method is before meals. About 15 minutes before lunch and dinner, drink a small glass of water, roughly 1 cup, or 150 to 200 milliliters. This does something very important physiologically. It prepares your digestive system, stimulates digestive enzymes, and slightly dilutes the contents of your stomach. That dilution slows how quickly carbohydrates are absorbed into your bloodstream. When carbohydrates enter your blood more gradually, your available insulin can actually keep up. Blood sugar rises more smoothly instead of spiking sharply. Clinical studies have shown that this simple habit can reduce post-meal glucose spikes by up to 20%. For many people, that's the difference between constantly chasing high numbers and finally feeling in control. The third timing point is during physical activity. If you walk, garden, clean the house, or do any activity lasting longer than 20 minutes, you need to drink water during the activity, not just afterward. Aim for small sips, about 100 to 120 milliliters every 15 minutes. This keeps blood volume stable and prevents the sudden drops or spikes in blood sugar that often occur with exertion in people with diabetes. Waiting until you're done means you're already dehydrated and your blood sugar has already been affected. Now let's talk about the 3 essential elements that make this method work. The first element is temperature. Room temperature or slightly warm water is best, especially in the morning and before meals. Cold water isn't harmful, but warm water keeps blood vessels relaxed and open, allowing insulin to circulate and reach cells more efficiently. Over time, this small difference compounds into meaningful improvement. The second element is minerals. Plain, demineralized water isn't enough on its own. Your cells need minerals to absorb and use water effectively. That's why the tiny pinch of natural sea salt matters. Unrefined sea salt or Himalayan salt contains sodium, potassium, and magnesium in a natural balance. Avoid processed table salt, which has been stripped of these trace minerals. Without minerals, much of the water you drink simply passes through without properly hydrating your cells. The third element is timing consistency. Your body thrives on routine. Drinking water at the same times every day helps regulate your metabolism and stabilize blood sugar patterns. Morning hydration at the same time, pre-meal hydration at regular intervals, and steady intake throughout the day all signal predictability and safety to your body. There's one additional step I recommend for many of my patients, especially those over 60. About 1 hour before bed, drink a final glass of warm water with 200 milligrams of magnesium citrate or magnesium glycinate dissolved in it. Magnesium is critical for insulin function, and most older adults are deficient without realizing it. Taken before bed, Magnesium helps muscles relax, improves sleep quality, and keeps blood sugar more stable overnight. Better sleep alone can significantly improve glucose control. I'm often asked exactly how much water someone should drink in a day. A simple guideline is to take your body weight in pounds and divide it by 2. That number in ounces is your baseline daily water intake. If you weigh 160 pounds, you need about 80 ounces of water per day, roughly 10 cups. If you exercise or spend time in warm environments, add 1 additional cup for every 20 minutes of activity or heat exposure. A quick way to check if you're hydrated properly is to look at your urine color. Pale yellow, similar to lemonade, is ideal. Dark yellow or amber means dehydration. Completely clear means you may be overhydrating. Pale yellow is your target. For practical implementation, I recommend using a reusable bottle that holds about 24 ounces. Fill it 3 times a day, once in the morning, once midday, and once in the afternoon. That's 72 ounces, which works well for most adults. Keep the bottle visible on your counter, desk, or in your car. Visual reminders are far more effective than relying on memory alone. So, what should you expect when you start this method? In the first week, you'll probably need to use the bathroom more frequently. This is normal. Your body is adjusting to proper hydration. By the second week, this usually settles down. You may notice your morning blood sugar dropping by 10 to 15 points. Not a dramatic overnight miracle, but a steady, consistent improvement. By weeks 2 and 3, energy levels often stabilize, afternoon crashes lessen, and post-meal readings become more predictable. By week 4, you may see your A1C beginning to trend downward. What I hear most often is this: I just feel better, more like myself again. That's the power of proper hydration. It doesn't cure diabetes, and it doesn't replace medication, but it helps your body work the way it was designed to work. Let me be very clear. Do not stop taking prescribed medications. Continue following your doctor's plan. This method supports your treatment. It doesn't replace it. I've had patients who, after several months, were able to reduce medication dosages under medical supervision because their metabolic function improved. Not because water replaced medicine, but because their bodies became more efficient. If you have kidney disease, speak with your physician before increasing water intake. If you're on blood pressure medication, monitor carefully, as hydration can lower blood pressure and may require adjustments. Report dizziness or lightheadedness to your doctor immediately. Let me tell you about Dorothy. She was 74 and had lived with diabetes for 19 years. Multiple medications, strict diets, education classes, and still her A1C climbed to 8.6. Insulin was being discussed. She felt like she had failed. Her hydration was minimal. Coffee in the morning, tea in the afternoon, very little plain water. She said she never felt thirsty and hated frequent bathroom trips. We started the H3 method together. The first week was inconvenient, but by 6 weeks she looked brighter, healthier, and happier. Her average readings dropped from over 190 to the mid-150s. 1 medication was reduced. 3 months later, her A1C was 7.3. She told me water gave her her life back. That's why I share this message. Because so many people are trying so hard and feeling defeated, when sometimes the solution is simpler than anyone ever explained. I want to challenge you to try this for 14 days. Follow the H3 method exactly. Morning water with salt and lemon. Water before meals. Consistent intake during the day. Magnesium water before bed. Track your blood sugar and notice how you feel. If you see improvement, keep going. If you made it this far, type, "I watched till the end," in the comments. Tell me if you're going to try the H3 method and what your biggest hydration challenge is. Share this with someone who needs it. Subscribe if you want more guidance on managing diabetes and metabolic health. Thank you for taking your health seriously. Small, consistent changes create measurable results over time. Take care of yourself. This is Dr. June Romeo, and I'll see you in the next.